Desensitization and counter-conditioning are two really valuable tools that we can use, especially in veterinary medicine, to help patients feel more comfortable with necessary treatments. With desensitization, the process is to introduce the learner to the stimulus that might be worrisome to them at a very low level at first, and then gradually, through a planned series of steps, increase the level of the stimulus that the learner is exposed to, hopefully without generating any kind of response from the learner. Through that process, the learner is going to be accustomed to whatever that stimulus is, so that they learn that it's an okay, safe stimulus and that there's no need to be upset, be excited, be affected by that stimulus in any way. With veterinary medicine, that's something that we run into all the time, because often we have to do procedures on pets that they may not like. Using desensitization to get them used to that procedure very gradually is something that can be really helpful in producing a cooperative patient that will allow you to work on them again in the future. Counter-conditioning is another really useful tool when we're working with pets, because it's a process that allows us to form a new association that's pleasurable with something that might be concerning. If we have a stimulus that causes concern and the learner causes worry, we can pair that with something that causes the opposite feeling, something that causes the learner to feel very content, very happy, very pleased. The hope then is that that stimulus is going to be presented followed by the new happy stimulus, and those two things will be linked, and we're going to get a new emotional response where the learner is feeling more happy and comfortable versus feeling uncomfortable or afraid. Today we're going to talk about giving a cat an injection. Ziggy is a 14-year-old cat, and the veterinarian has prescribed Adequan injections for him to be given twice a week and then once a week for his arthritis. The problem with this is that Ziggy doesn't particularly like getting injections, even for his vaccines. He's pretty needle shy. So we're going to work on doing a desensitization and counter-conditioning process to get him accustomed to accepting and perhaps even enjoying getting an injection. In order to make a plan for desensitization and counter-conditioning, we're going to break the process of giving an injection down into many steps that are small baby steps towards our goal. Cats are really good at connecting things like sounds with experiences. So I think we've all known a cat that you can crack open a cat food container and that little click of the can lid coming off, immediately the cat comes running, even though that's not intentionally trained. Well, I'd like for the Ziggy to have the same kind of experience when he hears, for instance, the syringe wrapper opening. So we're going to start there. We're going to use the syringe wrapper opening, then we're going to use the syringe coming out of the package, then we're going to progress to touching him lightly in the place where we would give an injection, touching him more firmly, touching him yet more firmly, giving a little bit of a pinch, a gentle pinch, progressing through a series of even stronger pinches, tapping his skin with the capped needle, and finally progressing to actually giving him an injection. It won't take very long to progress through these steps if we're cautious and go at the pace that Ziggy can accept, and if we make it worth his while on the counter-conditioning front. For counter-conditioning for him today, I'm going to use some canned cat food, which he usually thinks is pretty great. I'm going to use canned cat food in a dish. He quickly eats some every time it's presented, so that's going to make it really useful for me with my counter-conditioning process. I can present the dish, he'll have a quick bite, and then I can remove it. That's going to make it easy for me to associate the presentation of the dish with the stimulus that I'm trying to counter-condition, and then I can take away the dish when the stimulus I'm trying to counter-condition goes away. One of the important things to remember about counter-conditioning is it's really key that those two stimuli are linked. What I'm going to start with is just opening the syringe wrapper and making that syringe wrapper noise. So I'm going to open the syringe wrapper, and then I'm going to present the food. I'm going to make that syringe wrapper noise, then I'm going to stop the stimulus and stop the food. I'm going to set the syringe, I'm going to go ahead and give him a bite, and then I'm going to go ahead and stop both of those things. Cats are really astute to their environment. They're really detail oriented, and so I think things like counter-conditioning, even the presence of the syringe in a cat that's going to have injections on a regular basis at home, is a really valuable process. So now what I'm going to do is start getting him accustomed to the handling that's going to be necessary for us to give the injection. First, I'm just going to start by stroking the area. So I'm going to do stroking and present the dish. And I'm just stroking him right where I'm going to give the injection. I'm going to stop stroking and stop feeding. I'm going to stroke a little bit more firmly. And then these things are going to stop. Now I'm going to start introducing just a little bit of pinching of the skin. I'm just very gently pulling up on his skin and pinching the way that I would raise a tent to give an injection. Now I'm going to start raising the tent like I'm going to give an injection, and then I'm going to actually give a little pinch just in front right where the needle would go while he's having his food. Now what's going to happen is I'm going to start raising that tent. I'm actually going to poke with the capped needle, just right in that same area, and then we're going to stop. Now raise up that tent. And something nice is starting to happen. You might notice that when I start to stroke now, he's starting to look for this food. Got a little bit on the roof of your mouth. Notice that I stroked and he looked down to where the food's been coming from. That tells me that I'm starting to get that response that I'm looking for, that conditioned response. I'm going to raise that tent. He's thinking, where's my food? Practice. So it looks like to me he's about ready to get a real injection. So what I'm going to do is, I have an injection ready here. What's going to happen is, instead of using my pretend syringe, I'm going to use the real one. I'm going to do my little pinch. That predicts the food. I'm going to then produce the food. I have my syringe. I'm doing my little practice poke with my fingernail. I'm going to go ahead and give my injection. And we're all done. Once that stimulus stops, I'm going to take away the food. If we make a sensible plan of gradually increasing stimuli through baby steps, we should have success. If we pair desensitization, especially with counter conditioning, Ziggy is really highly food motivated, so he's a great candidate for using food for counter conditioning. If we can pair those baby steps of our stimulus also with something that the patient really likes, we can successfully counter condition so that giving an injection becomes something that Ziggy looks forward to, instead of something that he is worried about. And since getting that injection is vital for his health, we would like for him to enjoy it as much as possible.